Joining me now to discuss is Dr. Isaac Bogoch. He's an infectious disease specialist. Doctor, good morning. Good to see you.
Great to see you as well.
So we got a couple things to talk about. Let's begin with this study that shows that elderly Canadians who haven't had COVID could be at higher risk of serious infection if they're getting it for the first time. What does this mean?
Yeah, it's helpful to have a study like this, and we certainly have data from all over Canada and all over the world that really backs this up. If we look at who is hospitalized with COVID-19 right now in October of 2023, it is overwhelmingly older Canadians. It's overwhelmingly people over the age of 80, and then of course people over the age of 70, and those with underlying medical conditions that put them at greater risk for severe infection. But age is one of the biggest risk factors for severe infection. That's why it's especially important for people who are over 80 and certainly over 70 to come out and get their updated COVID-19 booster vaccine that's now pretty much available across the country. Now, older Canadians have been prioritized, and we know that, for example, vaccine rollout of COVID-19 boosters has really started, and it may even be completed in many of the highest risk settings, such as long-term care facilities and retirement homes and nursing homes. Now, that might not be true across the entire country, but certainly many places have already had access to the most at-risk Canadians.
All right, I'm confused because I've heard some medical experts say it's okay to get your flu shot and your COVID booster at the same time. Others say maybe you should space them out. What do you think?
It's really an individual choice. If people find it more convenient to get the flu shot and the COVID shot at the same time, you go ahead. It's no issue, and that certainly can be done. Some people might say, you know what? I'd rather not have two sore shoulders. I'd rather have one sore shoulder, and then I could wait and then see how I do and have another vaccine, a few days or a week or so later. That's also okay. I think the key thing here is we know we're going to have a flu season. We're already having COVID-19 circulate in high numbers in many areas. We have the tools to reduce the risk of severe infection, and it's important that people come out and get those vaccines.
Are you concerned about COVID-19 vaccine fatigue? People won't get another booster, another shot this year?
My biggest concern is that there's low uptake among the highest risk people. That by far is my biggest concern. It's no secret who is at greatest risk for severe infection: age and underlying medical comorbidities. That's why it's especially important to not just make the vaccines available to those individuals, but to lower any possible barrier to getting vaccinated. So what are we doing to bring the vaccine out to people? How do we ensure that homebound seniors are vaccinated? How do we ensure that vaccines are available in community centers, religious centers, neighborhoods that have traditionally low vaccine uptake, to really ensure that people who are at greatest risk for severe infection, like hospitalization and death, to ensure that those people have access to the vaccine.
Dr. Bogoch, thank you so much. Good to see you today. Dr. Isaac Bogoch is an infectious disease specialist.